How to easily explain adrenal disease. Easy explanations. Adrenal hormones. Adrenal insufficiency. Disease of the adrenal glands resulting in the lack of cortisol production. Can also result in the lack of DHEA, aldosterone, and disrupt the balance of endocrine hormones, electrolyte balances, and blood sugar levels. Cortisol. A glucocorticoid hormone, the body's stress hormone. Aldosterone, mineralocorticoid hormone that regulates electrolyte balances by instructing the kidney to release potassium and retain sodium. DHEA, the hormone that aids in the production of androgens and estrogens, which are the male and female sex hormones. Primary Addison's disease. The autoimmune disease resulting in the destruction of the adrenal glands, rendering them unable to produce proper amounts of cortisol, DHEA, and aldosterone. Secondary adrenal insufficiency. When the pituitary gland does not produce the hormone ACTH, resulting in the lack of cortisol production in the adrenal glands. Tertiary adrenal insufficiency. When the hypothalamus fails to release CRH, which stimulates the production of ACTH by the pituitary gland. Easy explanations. Diagnosis. The primary diagnostic test that endocrinologists use to diagnose adrenal disease. ACTH stimulation test. This test measures how well the adrenal glands respond to the release of the adrenocorticotropic hormone ACTH. When this test is done, blood is drawn prior to the injection of ACTH, then at 30-minute intervals for a few hours to test your adrenal response to the ACTH. If your cortisol levels do not rise properly, you are then diagnosed with adrenal insufficiency. Dexamethasone suppression test. This tests the adrenal gland function by measuring how the cortisol levels change in response to the steroid dexamethasone. This test has historically been used to diagnose depression as well. 8 a.m. cortisol blood draw. Your body's natural cortisol level should be the highest in the morning, according to your body's circadian rhythm. If your AM levels are low, it indicates an adrenal issue. Saliva and urine tests are also performed, but are not as widely accepted for diagnostic criteria. Easy explanations. Comparisons. Most people understand what diabetes is. Diabetes is the lack of the appropriate amount of insulin. Diabetics have to be vigilant of their blood sugar levels and manage their disease with insulin shots/pumps. This is very similar to adrenal disease. Just like a diabetic, the adrenal patient has to have an external source for their deficiency, but instead of insulin, we replace cortisol. Unfortunately, unlike the diabetics, we have no meter to check our cortisol levels. We have to physically watch our symptoms and stress dose or use an emergency injection if we drop too low. Lack of cortisol is deadly, and Addison's crisis will occur if an AI patient does not have cortisol replacement. Easy explanations. Adrenal crisis. An adrenal crisis presents differently for everyone, depending on which form of AI the person has. Some possible symptoms are blood pressure, heart rate changes, weakness, vomiting, trouble breathing, anxiety, flank pain, mental changes, and these are just a few of the symptoms. Everyone presents differently. It is important to always wear a medical alert bracelet and have an emergency injection with you at all times. An adrenal crisis will result in death if left untreated. Treatment for AI. Medications such as prednisone, dexamethasone, and hydrocortisone replace the steroid hormone cortisol in the body. Side note, everyone is different. Not all steroids work for everyone. Find the right one for you with your endocrinologist. The medication Florinef, fludrocortisone, is also used to treat the lack of aldosterone in the body. Not everyone with AI needs this medication, and it is primarily used in primary Addison's disease. Care essentials. Managing adrenal disease is different for everyone, but the absolute essentials for every AI patient are daily replacement cortisol medication, proper rest, hydration, stress management, and nutrition. It is essential to know the signs of low cortisol. There is no meter to check blood levels. respecting the physical limits of your body, having an emergency injection of cortisol with you at all times, and wearing a medical alert bracelet at all times. Life with AI. Adrenal disease certainly presents with its own unique challenges, but it is not impossible to live a happy life with adrenal insufficiency. Proper self-care, medication, and stress management are imperative to living the best life possible. All adrenal patients are different, but one thing is for sure, we have Addison's disease, but it does not have us. Thank you for watching. You can visit winslowedixon@wordpress.com to have more information.